Hello viewers, a very good morning to all the viewers. I am Dr. Seema Sharma, Senior Consultant OB-GYN from Apollo Hospital, Amritsar. Today my topic of discussion is fibroids in the uterus and how to manage them. First of all, what are fibroids? Fibroids are a commonest type of non-cancerous tumors in the females that can grow inside the uterus or outside the uterus. So no, not all the fibroids they cause symptoms, but when they do cause symptoms, symptoms are like heavy menstrual bleeding, back pain, or frequent urination. These are the few symptoms of the fibroids. So fibroids are the growths which are made up of smooth muscle fibers and the connective tissue. They grow from the muscular wall of the uterus, and these growths are usually not cancerous. To know about fibroids, we have to know a little bit about the uterus also. To know what is uterus? Uterus is a womb where the baby grows. So womb has this is a structure of the womb. So it is like a pear-shaped structure hanging in the pelvis. So you can imagine a womb like a room which has walls, and musculature is these walls are thick walls of the uterus, and it has an outer surface and inner surface, and then there is a cavity where the baby sits during pregnancy. So this is a kind of structure, and it is of the size of a small lemon or a pear, and which grows in pregnancy to large size, and whenever there is abnormal growth, then also it enlarges in size. So fibroids, they can be a small nodule in the uterus as small as a size of pea, or they can be large nodules as large as the size of watermelon or a big football. We have come across females, even younger females, who have large fibroids in their uterus, and they look like a full-term pregnancy. They are so large. So their size can vary, and they can be in the clusters also. They can be single nodule or they can be clusters. And in the cluster also, size can vary from 1 mm to 20 centimeters to 30 centimeters. They can be so large. So look, then comes the location of fibroids. Location of fibroids, all the fibroids, they develop from the muscular wall of the uterus. They develop from the muscular wall of the uterus, and some of them grow out towards the outer surface. These outer surface of the uterus, and they are known as, according to location, they are known as subserosal fibroids. And some of the fibroids, they keep growing in the muscle wall of the uterus, and they are known as intramural fibroids. Some of the fibroids grow towards the inner lining of the uterus, and they are known as submucosal fibroids. And some of the fibroids, they are just hanging into the uterine cavity, they are intracavitary fibroids. Some of the subserosal fibers which are present on the outer surface, they hang from the outer surface with the help of a small stalk, and they are known as pedunculated fibers. So these are different kind of fibroids according to the location, and I am telling you these location because it is very important to know these varieties of fibroid, because according to location, they have different symptoms, and their treatment plan also is different for different type of fibroids. Then coming to why are fibroids very common? This is a common question. Why are fibroids very common? Fibroids are the most commonest tumor of females. About 40 to 50% of females have fibroids, but since all fibroids are not symptomatic, so females, ladies don't even come to know that they have fibroids. So most of them come as a chance finding on ultrasonography or during examination, pelvic examination by a doctor. So coming to then causes of fibroid. What are the causes of fibroid? Fibroids, as we know that fibroid are the most commonest tumor during the childbearing age group of females between the age of 25 to 50. This is a childbearing when the hormones are maximum during the in the females. So their growth is, that shows that their growth is hormone dependent. Moreover, these tumors are very rare before puberty and they shrink after menopause. And during pregnancy, if the uterus have fibroid, it grows in size. So because there is excess of hormones for the growth of baby, and this hormone also increases the size of fibroid. So they are hormone dependent. Another cause is, having said that, it is also the fact that some of the younger females, like adolescent girls, have huge fibroids. These shows that if we trace their family history, they have, their moms have had fibroids, their grandma had fibroid, and their buas, masis, all one of them had fibroid uterus. So these fibroids have a genetic basis also, and they run in families also. Another point is that they have some racial predisposition also. Africans have higher incidence of fibroids than as compared to other races. And there are few risk factors also which play some role in the uh, development of these fibroids. These factors, risk factors which play a role in this fibroid formation are, the one is obesity. Obesity means higher body weight, which is at least 20% above the normal healthy body weight. This is responsible for fibroids. Early onset of menstruation and late menopause, they are also responsible for formation of fibroids. Not having children till the late age is also a factor for the development of fibroids. There's a saying that if you don't give pregnancy to the womb, womb is happy with the fibroids. So this is uh, uh, how important is kind of to have children at the right age also. So these are few factors which are responsible for the formation of uh, formation of uh, fibroids. Then coming to, I have already talked different locations of fibroid. They can be submucosal, they can be intramural, they can be subserosal, they can be pedunculated fibroids. Uh, then coming to next comes how these fibroids are diagnosed. These fibroids are diagnosed during pelvic examination by a gynecologist for a routine checkup or for some other disease. If gynecologist is examining the patient and they come across a solid irregular growth on the uterus, but patient has no symptom. Similarly, and they are also diagnosed as a chance finding on ultrasonography, which is done for some other reason, for some other pain abdomen or some other reason. Ultrasound is done and they are diagnosed. Once the diagnosis is done, and sometimes patient have few symptoms, also have heavy bleeding or pain during periods, then it alerts the physician or a gynecologist that she might have some fibroid uterus. And then for the making the diagnosis and for confirming the finding of these fibroids, we have various imaging modalities which are used to confirm the diagnosis or to make the diagnosis. First is ultrasonography. Ultrasonography can be done transabdominally or it can be done transvaginally. Transabdominal and transvaginal. Transvaginal is more useful if the fibroids are located inside the cavity, because they sometimes can be missed on the transabdominal ultrasonography. This is a very good modality for diagnosing the fibroids. If there is a large fibroid or multiple fibers, then even MRI pelvis is done for the mapping of fibers and for the plan of further treatment or surgical treatment. Similarly, these fibroids can be diagnosed during uh, while doing histoscopy. When the scope is put inside the uterus through the vagina, especially in cases of patients who are seeking fertility, then sometimes fibers are seen in the cavity. Similarly, laparoscopy is being done for some other lap, for some other reason, some other surgical reasons, and then one comes to know that uterus also have fibroid. So these are various modalities which help in diagnosis. Then coming to the once the diagnosis is made and patient knows that she has fibroid, first question that comes to her mind is it why it happened to me? So I have already discussed the etiology. Exact cause of fibroid is never known why it happened to her, but there are few family history uh, is then asked, and if there is history of family history of fibroids in her grandmother, then it is just inherent tendency to have fibroid. So similarly, then second question that comes is it risky to have fibroids? They have inside fear, or they are scared that it might turn malignant or cancerous. So these fibroids, answer to this question is that these fibroids are the least tendency to turn into malignancy, because they are the most common benign tumor, and very rarely they turn into cancerous formation. But small fibers, that is why small fibers can be left alone, they need no treatment. But fibers which are moderate in size, 8 to 10 centimeter, they have to be kept under observation. So see whether they grow in size or they shrink over the period of time. But fibers which develop after menopause, or they grow in size after menopause, they have to be evaluated immediately. So there is no test which is 100% predictive that they might turn malignant or not. But we have to keep these fibers under observation. But in general, we don't need to be scared, because rate of conversion to cancer is very low. So next is what are the symptoms of these fibroids? This is the most common tumor, and most of the patients, they are asymptomatic. About 80% of the fibroids, they don't give any symptoms. So that is why patient, even they don't come to know that they have fibroids. Rest 20% have symptoms, but out of that 20% also, they have mild symptom, 10% have mild symptom, and another 10% have severe symptoms. These symptoms can vary. There can be excessive bleeding during the periods. The bleeding pattern can be different. They might have periods for the same duration of length of time, that is 4 to 5 days, but bleeding is very heavy with passage of clots, or they have prolonged bleeding time. Might range from 10 to 15 days, or some of the patients, they keep on bleeding off and on throughout the month. Some have intermittent bleeding in between the periods. So these bleeding, there are different bleeding patterns depending upon the number, location, and size of fibroids. It is very important to know what is the how many fibroids are there, what is the size of the fibroid, where the fibroid are located, because the fibroid which are located towards the inner lining of the uterus, that is the submucosal fibroids, they are the most notorious to cause the symptoms. With excessive bleeding, pain is also associated with the uh, bleeding, and they have mild to severe pain abdomen during the periods or before the periods also. Some of the patients have low backache, and they have heaviness in the lower abdominal cavity. These symptoms are associated with in few patients, and patients who have regularly heavy bleeding, they can also present with low hemoglobin, that is anemia. Then they have tiredness, breathlessness, And when you ask the history, they say the period is same as earlier, but they don't realize because they consider the normal bleeding, heavy bleeding, as a normal bleeding only. That's quite a bit of female, they think like that, but when you check their hemoglobin, it is very low. So they come with the other complications of breathlessness, tiredness, uh, to OPDs. So another other symptoms which are associated with the fibroids are, if the fibroids grow in size, they are large in size, they have pressure symptoms. Pressure symptom in the form of frequent urination, incomplete evacuation of urine, or retention of urine. Uh, they have difficulty in uh, uh, difficulty during, they have pain during sex. They have if the fibers are located on the posterior surface of the uterus, they have constipation also. Some of them have chronic vaginal discharge because of some fibroid hanging from inside the cavity of the uterus. So these are some of the symptoms. And some of the patients who are seeking fertility, their fertility is also affected. So these fibers are responsible for infertility or subfertility too. Uh, Patients who are seeking fertility, they also give history of repeated miscarriages, uh, uh, and they are not able to have normal full-term baby. So these fibers, which are specially located inside the uterus, they are notorious to give the symptoms of infertility and repeated miscarriages. Even if patient conceive, they might have, because of fibers, they might have preterm deliveries also. And the symptoms are mostly dependent upon the location and number and size of fibroids. And then coming to the pain part, what is the like intensity of fibroid pain? It can be dull pain and during the periods, like a menstrual cramps, or it can be backache, or some of the patient who have some mucosal fibers, they have severe spasmodic pains also during the periods. And it may start before the periods and it may last throughout the cycle also. So next question that comes to us after the diagnosis is, will fibroid grow over a period of time? So or they change their size during the over a period of time. Yeah, so yes, fibers, they change their size over a period of time during the mostly the childbearing phase of the women. They generally grow. Some of them are some of them have slow growth, and some of them grow very rapidly. We can't predict how much they are going to grow, or they can be small fibers. Sometimes they lie in a kind of latent phase only, they don't grow at all. But after menopause, definitely fibers, they shrink in size, and during pregnancy also these fibers grow in size. So if anybody who is pregnant and knows about the fibroid, they must tell the doctor in hand beforehand that they have fibers, so that their fibers can be monitored regularly during the pregnancy. And because these fibers are sometimes they cause complication during pregnancy, they can have, these patients can have more of abdominal pain, they lower abdominal heaviness, and when they increase in size, they cause small presentation of baby. Baby can't take rotate inside the womb freely, and they hinder the movement of baby, and babies are normally in the malpresentation, breech presentation, or transverse presentations are seen. And sometimes these pregnant patient might have preterm delivery, and some patients land up with cesarean section because of big fibroids causing hindrance to the normal delivery even. So this is how the growth of uh, um, fibers. And once the fibers are diagnosed, and then comes how the fibers are treated. So treatment part of fibroid is very important also. and it treatment varies according to the size, number and location of the fibroids, and whether as well whether the patient is having some symptoms of the fibroid or they are asymptomatic. So if the patient is not experiencing any symptoms from, if it is a asymptomatic fibroid, you might not that patient might not need any treatment. Small fibers, they can be left alone, and moderate size fibers, they are kept under observation for the growth of their for their growth to see. So some of the patient who are symptomatic, they should be treated. So depending upon how what are the symptoms and how much uh, pain and bleeding is there, depending upon the symptoms, the different mode of treatment is planned for every patient. And for treatment plan, it is very important to know few factors: how many fibroids you have, the size of fibroids, where the fibroids are located, and whether the symptoms are troubling or not, on your desire for pregnancy, your desire to preserve the uterus. So fertility part is very important. If the patient is uh, kind of looking for fertility, and size of, and it is infertility is an issue, then patient need to be treated. Or if the patient has excessive symptoms of excessive bleeding and pain, then also symptomatic patient also need treatment. Treatment options, there are different treatment options available. Some of them are medical treatment, over the counter drugs are present, which can be, these are analgesics, which are only symptomatic treatment to relieve the pain of the patient. And some of the drugs are uh, like a hemostatic agent, tranexamic acid and all, which are used to reduce the blood flow during periods. These are symptomatic treatments. Some of the then comes the treatment which is used to um, uh, reduce the size of the fibroid and temporarily give relief to the patient. These are hormonal preparations, oral contraceptive pills, or gonadotropin releasing hormone agonists. These are called GnRH agonists. These are the medications which are used to reduce bleeding during the periods. And these drugs are, when used continuously, they create a situation like menopause, and blood flow to the fibers is cut off, and temporarily these fibers shrink in size. And but once these drugs are stopped, again the fibers start growing, and patient starts having gradually the same pattern of bleeding. So there is no permanent solution by medication. These drugs are only used when we are preparing for the surgery, or patient doesn't want immediate surgical intervention, or to build up the patient before the surgery, to build up for the hemoglobin level and all, so that patient doesn't lose blood continuously. These drugs can be used. Then comes the surgical treatment, and surgical treatment is the definitive treatment, because we have to, surgical treatment can be two types of treatment. It depends upon whether patient wants to have children, or already the family is completed, and depends upon the age of the patient also. So if the patient is younger age group and looking for fertility, then we remove only the fibroid from the uterus, and uterus is preserved. This type of operation is known as myomectomy. So myomectomy further can be, it can be done through histoscopy, it can be done through laparoscopy, or it can be done through laparotomy. So what is histoscopic myomectomy? If the fibroid is inside the uterine cavity, then a scope, a telescope, which is put inside the uterus through the vagina and mouth of uterus into the uterine cavity, and fibroid is located, and then it can be resected with the help of resectoscope, and fibroid are removed through the vagina. So that is histoscopic myomectomy. If the fibroid is towards the outer surface of the uterus, then a laparoscope is used and telescope is put through the abdomen and into the abdominal cavity, and various incisions or small cuts are made on the abdomen, and through that surgery is performed, uterus is opened, fibroid is removed from the uterus, and then uterus is sutured. So that is laparoscopic myomectomy. So laparoscopic myomectomy in fact is now gold standard for younger patients who are seeking fertility, or very young patients who are unmarried and they have uh, they already unmarried and they have for their further life ahead of them. They laparoscopic myomectomy is a gold standard for them. Then comes the laparotomy. Laparotomy is by giving is an open surgery, is the open myomectomy, and incision is given over the abdomen, and then uh, uterus is opened and fibroid is removed. So type of hysterectomy and depends upon the what is the number of fibroid, what is the size of fibroid, where the fibroid is located, plus what is the desire of patient, what type of surgery patient want, and what kind of surgery is available at the center. So there's so many factors which influence the type of surgery, but ideally histoscopic and laparoscopic myomectomy are the best surgeries, because blood loss is very less in these kind of surgeries, and patient recovers very quickly after laparoscopic surgery and histoscopic myomectomy. So these are the surgical modalities, and for the patient who have already completed their family and they are a bit later age group, they are 45 plus, they have multiple fibroids or their fibroids are big fibroid, and they don't they are not willing to keep their uterus. They are scared that they might have it, the fibroids again. So in those cases, complete removal of uterus leaving behind the ovaries is also an option. This is called hysterectomy. Hysterectomy is a definitive treatment when we are sure that this patient is not going to get fibroids in lifetime, and this hysterectomy similarly can be done as an open hysterectomy, or it can be done laparoscopically, which is called total laparoscopic hysterectomy, TLH. So these are the kind of treatments available. So there are few other treatments which are not that popular, but still they are the modalities to deal with the fibers. There is a treatment, umbilical artery. These are uterine fibroid embolization is another option for the for treating fibroids. This is done comparatively in patients who are seeking fertility or younger age group, and they don't want a surgical option. Here the uterine artery is we take the help of radiologists, interventional radiologists, who puts a catheter in the uterine artery. Uterine artery is a artery which supplies the uterus and hence the fibroids also. So this uterine artery is blocked with the help of particles, and this when the artery is not supplying the fiber, it shrinks the fibroid and almost 50% symptoms are relieved. This is done in patients who are not fit for surgery, who don't want surgery, and who are comparatively younger. And then comes a radio frequency ablations, which can be done. It is also very safe and effective treatment with symptomatic fibers, then can deliver laparoscopically, transvaginally, and then through transcervical approaches. There is another newer uh, procedure which can be which is called magnetic resonance imaging, MRI guided focus ultrasound, that is used to treat fibroid. The technique is actually done while patient is inside the MRI machine, and mapping is done of the fibroid with the help of MRI, and then the targeted ultrasound beams are given to the fibroid, and these beams damages the fibroid, and fibroid and symptomatic relief to the patient is given, though they are not 100% successful in completely removing the fibroid, but to some extent they relieve the patient of the symptoms. These modalities are also used in younger age groups. So this is all about the treatments and symptoms and how they come, how they grow. And to sum up, fibroids are the common tumor. If you are diagnosed with fibroids, don't get scared. They have least tendency to get malignant or to turn into cancer. If they are small, they can be left behind. If they are moderate size, they have to be kept under observation. If you have symptoms because of fibers, get in touch with your doctor, use medication. There are several medical and surgical options. Take the help of a doctor. And if you are seeking fertility, do get your fibroids removed. You will get good results. So this is all about fibroids. If you have any questions or queries, I am there to answer you. Thank you very much for the patient listening. Questions, counsel. Yeah, there is a question that can fibroid recur after getting it removed surgically? If it is a kind of inherent tendency to get fibroids. If one fibroid is removed and there are some small seedling fibroid inside the uterus which are still there and which are not visible to the eye, which are not otherwise also visible, you can have fibroid, some fibroids again, but it's a slow growth. So it is after few years you come to know that you have fibroids again. So we encounter so many patients who had one fibroid surgery and they come up with again with the fibroid problem. Another question: how does fibroid affect the pregnancy? Fibroids, I've already explained, fibroids grow during pregnancy and they increase in size during pregnancy because there is a lot of surge of hormones during pregnancy, and it increases in size and they might cause some pressure symptoms of heaviness, backache, lower abdominal pain during the pregnancy. And some of the pregnancies all have serious afflictions also, like they might have malpresentation. Baby can't take a proper position because it hinders with the rotation of the baby, so they might have malpresentation in the form of breech presentation or some transverse position. Some of the fibroids, they affect the early pregnancy in the form of miscarriages. They can't carry the pregnancy, and pregnancies are missed. Some of the pregnancies, if they are not missed in early phase, they might land up with the preterm deliveries because they are the space occupying lesions basically, so they can affect pregnancy. Another question: should we avoid any kind of food if we have fibroid? Fibroids, any dietary restrictions actually don't affect the formation of fibroids or growth of fibroids, but unhealthy lifestyle to some extent is responsible, because if you have more body weight, if you are obese, you are not maintaining healthy lifestyle or eating pattern or exercise pattern, that there are more chances of getting fibroids. What does embolization of fibroid mean? Embolization of fibroid is, I've already explained in this, the blood vessel which supplies the fibroid, which supplies the uterus, is embolized with the help of particles which block this artery. So blood supply to the fibroid is cut and fibroid reduces in size. Does embolization has any age restriction? Uh, Actually, embolization it doesn't have any age restriction, but uh, in younger age group, patients generally don't want surgical options, and in later age group, when The family is completed. Patient want a curative treatment, and embolization to some extent relieves the symptom, but it is not 100% curative, because gradually the uterus will pick up blood supply from other vessels, so they again start having these symptoms. Another question: a small size fibroid was detected during my pregnancy, and now I am 5 months postpartum, but there are no symptoms as such. Should I get myself checked for the same? Yeah, if the fibroid was small and it was detected during pregnancy, for your satisfaction, you can go ahead with the ultrasound and just check the size of the fibroid. If it is small, nothing to be worried about, and just a plain ultrasonography will help you in sorting out whether the fibroid is still there, or it has shrunken, or it has grown in size. Any more questions? Thank you very much for the patient listening.